Hey, it's Dr. Trish Leigh with another Neurofeedback Q&A. Keep them coming. I've had a lot of awesome questions about neurofeedback and about brain matters for that sake. So if you have a question, send me an email at info@drtrishleigh.com. I'd be happy to answer. Okay, so today's question is about neurofeedback for young children, specifically a 2-year-old. So I wanted to make sure that I answered this because the way that neurofeedback works when we perform a qEEG brain map to assess brain performance pattern is that map for that young child is compared against a very large normative database, it's called. So what it means is that 2-year-old's brain is compared to other 2-year-olds, and then the discrepancy between optimal functioning and how that kiddo's brain is performing is assessed. So most of the databases go down to 2 years old. That's what you want to make sure from your provider, that they're using a database that goes down to the age of 2. That would be the important factor on a provider by provider basis. But that being said, if you know your child has a significant developmental delay or disorder, we know from the science that those delays and disorders are created typically by excessive use of too much slow and extra slow brain speed. So that is what we are looking for in the brain map. So if you have a child who has significant sensory processing disorder, who has a measurable, if you've had an evaluation, has a measurable delay or disorder, then you know that the brain isn't performing as well as it could. And it would be an awesome idea to have a brain map so you can see specifically what areas of the brain are processing too slow. Many times there's compensatory extra fast brain speed that is also being used, which would be good to know, because then you can optimize your child's brain pattern earlier. And that's important because it's called a critical period of development. Now, we know from neuroscience that our brains are neuroplastic across our entire lifetime. Thank God, right? As I get older and older. But we also know that very young kids' brains are more plastic, and that's because that brain pattern has only been used for 2 years. It hasn't been used for 20 years. And brain patterns and neural pathways are kind of like trenches. The more we use them, the more that they are dug. So what happens if you have your child's brain assessed at the age of 2 and you start neurofeedback brain training therapy, and then on top of it, you get every other therapy that you can, speech language pathology, occupational therapy, physical therapy, vision therapy, hearing therapy, whatever it might be that is appropriate from your comprehensive evaluation, what you're going to do is start burning in the appropriate, healthier neural pathways. And the earlier that we do that, the more you will change the trajectory of development for your child. And I've been soapboxing on trajectory of development and changing it at its core for 25 years, believe it or not. If any of my old students from my university are watching now, they know exactly what I'm talking about, the soapbox of me saying, and actually I used to use PowerPoint slides where I would show a rocket, and if a rocket took off from here, it would only have this trajectory unless something fundamental happened that changed the projectile's trajectory so that now it can go like this. I believe that neurofeedback is the very therapy that changes that trajectory. So now across that child's lifetime, they're no longer developing like this. They are developing like this on to reach their full potential. And it's all based on neuroscience and neuroplasticity, because if this irregular, less than optimal brain pattern is used across their lifetime, it's going to burn itself in and it's going to create more issues and more challenges as it's being used in preschool, in elementary, in middle school, in high school, in college. When all of that is difficult, that creates and sustains a negative feedback loop. When we change it at the age of 2, now we're like this. Preschool's better and more learning happens, more socialization, which allows for kindergarten to be an easier transition. Life is better, academics are better, social skills are better, home life is better, which makes elementary better in all those regards, which makes middle school better, which makes high school better, which makes college better, which makes adulthood better. That's the trajectory of development. Sorry about the soapbox. I'm having flashbacks to my college teaching days, but hopefully you get the point. So if you're out there and you have a 2-year-old that you're concerned about, get a qEEG brain map, because it will give you the information that you need so you can make informed decisions. And that is empowerment. And I started as an early interventionist with 2-year-olds. 2-year-olds are my favorite kids to work with because I can change their whole life. Of course, I like working with everybody else so I can change their life too, but the younger, the better. So run, don't walk to your neurofeedback provider, get a qEEG brain map, see what your kiddo's brain is doing. Hopefully that person will know enough about all the rest of the types of therapy and can make some really informed and educated recommendations for you, and you can start moving in the right direction for your little one. Okay, I hope that helps. That is a good answer to your question. And remember, email me, info@drtrishleigh.com if you have any more questions. I'm always happy to answer. Thanks.